The skeleton is made up of 206 bones and is divided into two different parts, the axial skeleton and the appendicular skeleton. The axial is considered the core unit, which include the skull, vertebrae, ribs and sternum. The appendicular consists of the bones in the arms and legs that come from the pelvic and shoulder girdle. The process of bone creation is called ossification. They are primarily made up of connective tissue and specialized bone cells. They also contain bone marrow where blood cells are made. Bones are constantly remodeling themselves and breaking down old tissue. In turn, our skeleton is renewed every 10 years. The bone cells that are included in this process are osteoblasts, which are cells that build bone tissue, osteocytes, the cells that maintain bone tissue by controlling mineral and calcium, and osteoclasts. These are the cells that break down old bone tissue. There are many layers of bone tissue, which include periosteum, which are dense and tough outer layer that contains blood vessels and nerves, compact and dense tissue, which is hard, smooth layer that protects inner tissue, spongy or calcaneous or cancellous tissue, porous and honeycomb material, can be found inside most bones, which allows the bone to be strong and lightweight. Bone marrow, which is jelly-like in consistency and found inside some bones, including the pelvis, and produces blood cells. It produces red and white blood cells and also platelets. Red is for oxygen, white for immunity, and platelets for clotting. There are many different types of bones which have a different function. Flat bones protect internal organs. The skull protects the brain, the thoracic cage protects heart and lungs, and the pelvis protects reproductive and urinary organs. They also have large surface areas to provide origin and attachment points for the musculoskeletal system. Long bones assist in supporting weight and to facilitate movement. They are located in the appendicular skeleton. Short bones are cube-shaped and located in the ankle and wrist joints. They provide stability and some movement in flexion and extension. Irregular bones are complex in shape, which help protect internal organs. For example, vertebral column protects the spinal cord, and the pubis or ilium or ischium protect the pelvic cavity. Sesamoid bones are used to reinforce tendons and are commonly found in the hands, knees, and feet. They protect from stress and general wear and tear. Ligaments attach bone to bone and allow the form of the skeleton. Tendons attach muscle to bone, which makes up the musculoskeletal system that allows the body to move. The function of the skeleton is to provide support for your body. It gives our body shape, allows movement, makes blood cells, provides protection for organs, as the skull for the brain, ribs for the heart and lungs, spine for the spinal cord, and stores minerals like calcium and vitamin D. The fibula can be located laterally to the tibia. Its main function is to combine with the tibia by an interosseous membrane and provide stability within the ankle joint. The apex of the fibula is located proximally to the knee joint and posterior-laterally. It provides an insertion point for the bicep femoris muscle and attachment sites for the fibular collateral and arcuate popliteal ligaments. The articular facet head of the fibula is a flat circle area that can be located at the superior medial aspect of the fibular head and forms a superior tibiofibular joint. The articular facet of the lateral malleolus is a flat triangular-shaped area that is located distally on the anterior to the malleolar fossa of the fibula and articulates with the lateral malleolar facet of the talus to contribute to formation of the ankle joint. It provides attachment points for posterior tibiofibular, posterior talofibular, and calcaneofibular and interosseous tibiofibular ligaments, which contribute to stabilizing the joint. The malleolar groove is a smooth vertical depression on the posterior aspect of the lateral malleolus where the fibularis longus and fibularis brevis tendons pass through. The medial crest is the border of the fibula and usually sharp and located in the posterior surface. It provides an attachment site for the deep fascia which separates the tibialis posterior and flexor hallucis longus muscles. There are three types of joints. One is fibrous, which forms strong connections between bones. For example, sutures join most bones of the skull. Interosseous membrane forms a syndesmosis between the radius and ulnar bones of forearm. And gomphosis is a specialized fibrous joint that anchors a tooth to its socket in the jaw. Cartilaginous bones are bones that are entirely joined by cartilage, either hyaline or fibro. Generally, more movement than fibrous joints, but less movement than synovial. Mostly present in ossification centers of developing bones and absent in the mature skeleton, although some persist in adults. Fibrocartilage joints are permanent joints called symphyses. They allow slight movement and found at skeletal midline. For example, symphysis pubis, which is between the right and left pubic bones, and the manubriosternal joint, which is between the sternal body and the manubrium, and intervertebral disc and sacrooccygeal symphysis. Synovial, which are types of joints that are found between bones that move against each other, such as the shoulder, hip, elbow, and knee. This particular joint is filled with fluid. It is also made up of cartilage, the joint's capsule, synovial fluid, and synovial membrane. Within a synovial joint, there is cartilage, which is smooth, gristly material which covers surface area of bone. It acts as a shock absorber and reduces friction between bones. Then there is a joint capsule, which is a fibrous material that encloses the joint. With ligaments, tendons, and muscle, the capsule keeps everything in place. Then there is synovial fluid, which is clear sticky substance that is used for nourishing and lubricating the cartilage surface as they move against each other. Then finally, there is the synovial membrane, or the synovium. Tendon properties. As they are unique in their structure and function, they possess characteristic biomechanical properties including high mechanical strength and viscoelasticity that allows them to transmit mechanical loads, musical force effectively. They are also mechano-responsive in terms that they change their structure and function due to different load conditions. Loading at physiological levels is beneficial for tendon strength, however, overloading can be detrimental. As for their function, they play an essential role in the musculoskeletal system by transferring tensile loads from muscle to bone, which allows simple movement and stabilization. There are two types of tendon. Load-transmitting tendons can be found around the patella and Achilles, and tendons that are motion-transmitting, such as flexor tendons. Ligament properties. The basic properties of ligaments are collagen fibers. They are usually quite strong and resistant to damage or injury from pulling or compressing motions. Collagen fibers usually run in parallel bundles, which contribute to the strength of individual fibers. Ligaments attach to the outer surface of bone, the periosteum. Depending on their positions, some ligaments stretch and others tighten. As for their function, ligaments have several jobs in which are vital to human movement and stability. They allow the joint to move in the direction it is allowed to move in. They hold bones together, ensure joints don't twist, stabilize muscles and bones, and strengthen joints, and also prevent bones from dislocating. Cartilage is a tough, semi-transparent, elastic and flexible connective tissue which includes cells through glycoprotein material that is strengthened by collagen fibers. There are no nerves or blood flow within cartilage. It can be located within the rib cage, the ears, nose, throat, and between vertebral discs. As for their function, its sole purpose is to resist comprehensive forces, enhance bone resilience, and provide support on bony areas where there is a need for flexibility. It can also present itself in different areas of the body which give shape, support, and structure. The result of bad posture presents itself with many symptoms. For example, these can include rounded shoulders, bent knees when standing or walking, hyper anterior or posterior tilt of the head when walking, back pain, aches and pains, muscle fatigue, and headaches. For instance, if an individual suffered with hyperkyphosis, this would affect their ability to breathe with ease and equally disrupt their digestive system, whilst also affecting sleep patterns. Hyperkyphosis also contributes to thoracic back pain as the muscles are overstretched and become easily fatigued. It can also interfere with the nervous system, depending on if any muscular systems are in constant contraction and impinging on a nerve. This can happen with poor manual handling and lifting techniques and may possibly affect the musculoskeletal system. In a workplace environment, poor lifting techniques contribute to over a third of all workplace injuries. Superficial injuries include bruising, cuts, sprains and strains, and tears. In a more serious event, these can include musculoskeletal disorders due to improper posture or repetitive use, hernias, hand or foot injuries, back injuries such as herniated or slipped vertebral discs, which is the most common injury due to poor lifting techniques. Good posture refers to the maintenance of the natural curves in your spine in the cervical, thoracic, and lumbar regions. When stood still, if you are free of any medical issues, you should be able to stand up straight and tall, shoulders back and in line with ears. Abdomen is strong, arms naturally fall beside you with knuckles facing out and feet are shoulder width apart. The human body is susceptible to bad habits, so with practice, you can train your body to rest in the proper neutral format, which will increase confidence in how you feel. You can also improve general posture by staying active, maintaining a healthy weight, comfortable and sensible heeled shoes, and working at surfaces at a comfortable height. When lifting heavy materials, it is crucially important to maintain good posture. Remember to maintain foot distance at shoulder width apart, your back is straight and chest is out. Squat using only your knees whilst maintaining a straight back, and slowly lift with the item, holding the item close to your body and do not twist. This will reduce the risk of any potential injuries.